Hi everyone, this is Neil Writer, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. And here we have a patient aged 14, and unfortunately they suffer from chronic otitis externa. In this their right ear alone, the left ear is completely fine. And periodically, probably every 6 months or so, they do have to attend to have their wax and dead skin removed from their ear. They've been seen by ENT before, and there's no real treatment at the moment. It's just more management. They typically get on fine, however. It's just when their ears feel blocked, and it's obviously quite frequent, they just need to have it removed. And what's interesting about this case is that laterally, so near the entrance, you can see the patient's been scratching his ear on the right hand side. There's a bit of a sore spot there. Laterally, the wax is extremely mushy, and I always have to extract it from the floor. So that's why you can see I'm aiming the suction tip at the floor. And once I separate it from the floor, I can then bring the whole plug away. But they've got this little ditch just past the entrance. It's quite difficult getting access in there. Beyond this, they've got the complete opposite. They've got dry, crusted wax and skin all plastered over the eardrum. So this is one of the benefits of the WAXscope. It's got high-level magnification. So removing wax of the eardrum is not easy. So I'm not saying anyone who purchased the WAXscope will be able to remove wax of the eardrum, but it gives you the magnification to allow you to, if you have the skill level. With some other devices that's on the market, you just don't have the magnification. So even if you do possess the skill level, you don't possess the vision and the magnification to safely extract wax of the eardrum. But you'll see here, once I remove this lateral plug, we're going to go directly on the eardrum, and we're going to slowly peel away dry, crusted, oxidized wax and skin. It's almost pitch black in appearance. So you can see I separated it from the floor. Now I'm going to slowly bring it forwards. I'm probably going to go to the top part of this wax and drag it forwards, but the entrance is quite narrow and this plug is quite large. So it was difficult bringing it through. I joked during the procedure, it's like giving birth, and I can see the head of the wax, but we did manage it in the end. I think I'm going to put a bit more oil because you can see it's quite mushy. Not really tempted to correct. I couldn't hook it because it will just slice through. Of course, you can't use forceps, it's too soft. And even with a correct, with this consistency, what often happens, you might get some of it out, but it smears the wax and skin against the ear canal. So it's not really a favourable consistency sometimes for correcting this. So I'm just persevering with suctions. I've got a good grip. You can see I have to lift it up and over the steps at the bottom of the screen. You'll see the canal, and just beyond where you can see no longer it dips down. So I'm lifting it up over that step, but I can just feel it's trapped at the top because it's so large. So I'm going to try and wriggle this through. At the moment, I'm using the 14 gauge suction probe. This is your standard Zollner suction probe, what we normally use. When I work on the eardrum, I use both the 16 gauge and also the 17 gauge. So the 17 gauge is the fine end. Previously, I used to use the 18, but I much prefer the 17. So I've just put some oil in just to lubricate the canal wall to reduce any friction, so I can slide this out. I think it worked pretty well, if memory serves me correct. In terms of the specular size, I'm using the medium size specular. So the cartilage near the entrance is quite elastic, so it allows me to stretch it. They have got quite a bendy ear canal, so you'll see once I remove this and I'm removing wax off the eardrum, I'm having to manipulate the specular once it's in the ear to get the view that I wanted. As you can see, I'm coming up and over. And these little wriggle movements do help because it just helps to tease it out. But just like there, it came away too quickly, so I lost the suction power. I'm just finding a spot on the wax where I can generate some good suction. Some of this wax is mushy as well, so it's getting suctioned up. So it's not bringing the plug forwards. It's just getting vacuum. So I'm just clearing that. Just going for the top for a moment, just to tuck it in, because it's such a large plug. I'm just want to tuck it in all the way around. the entrance of the ear, and I think I managed that there. I'm trying also not to come away with the specular too quick, because the specular is opening up the ear, which is quite useful here. You can see, just bringing it under the top part of the ear canal. Again, this piece of wax is quite mushy, so it's just getting vacuumed. Just want to tuck it in from the front and back part of the ear canal again. There we are, managed to bring it through. Almost. So I'm using the left-hand side of the specular to dilate open the ear. And I just want to keep that suction firmly on the wax to generate the vacuum, and then slowly come away. And now this plug is visible to the naked eye. So the deeper side of the plug was actually a bit firmer, it's just more the lateral surface. There we are. So half the job done. There's just a loose bit here. And you can see in the distance it's dark now. I'm going to get that in focus in a minute, but that's just crusted dry wax. So I have to stretch the ear to the left. You can just see the second bend to the right, and when I'm working a bit deeper in the ear in a moment, I am going to tuck the specular inside that second bend, but at the moment the view is okay because I'm working at the bottom. So again, I'm stretching open the ear. So you can see I've tucked the right hand side of the specular inside that second bend, so I get more of a fuller view. That was a bit frustrating because there's a loose, I've opened up the ear quite nicely there, and the suction probe got blocked. I came out, I think it might have unblocked itself. Yeah, no, it's still there, you can see. So once more, stretching the ear to the left, and then just gliding slightly forwards, just trying to get inside that second bend. And I believe I'm using the 16 gauge now. Once more, I'm tucking it in. So this crusted skin, it's right on the drum. And you're going to see we're going to go to the top part and peel it down. When it's crusted like this and it's stuck, sometimes it's hard to get a suction grip, so be very gentle. I am going to put some oil in a moment, I think, as well. This patient does always have some residual dry crusted wax skin on the eardrum, but not as much as this. It's a bit more than usual. So I've got that centre bit, the more golden colour, crisp focus. You can see the eardrum flex slightly as well. You can see the precision we can do these procedures with the WAXscope because of the magnification. So the posterior quadrant, so the back half of the eardrum is more or less visible. There's just this piece of skin just past the second bend. I'm just going to clear this just so I can get a better view of the front part of the ear canal. So I'm just mopping that up. And again, I'm going to stretch it, enter, and then straighten. You can see there's that hard boulder of wax. We can see the front part of the eardrum now. Before we were focused on the back part, now we can see the front part. I'm just going to peel it from right to left, so it's stuck in the anterior recess. There we are. There's another piece behind that as well, and that's directly on the drum. So I'm going to tuck that specular in. I'll probably go for that middle bit first. And this really highlights and illustrates the benefits of the WAXscope, where we can do procedures like this. So the eardrum is slowly revealing itself. We got this bit in the middle. I think this came away in two pieces instead of one. I think this separated. This is the piece below the umbo. The umbo is the part of the hammer bone that attaches to the middle of the eardrum. So this is just below the umbo. It's hiding the light reflex. So the bottom right corner of the, well, not bottom right, bottom right of the umbo region, you'll see, you might have seen it there, you get the reflection of the torch coming back from the eardrum. So that's now fully visible. I'm just going to get this bit from the anterior recess, just getting it in focus. Again, I'm going to make contact and then pull right to left. And then there's just a few loose pieces. One in the top right hand corner of the eardrum, which I'm going to go for now, I think. And it was quite stubborn actually, it was stuck. You can see that there. And the surface of this is like sandpaper, it's really rough. So I've just got that in focus. I may have reverted to the 17 gauge for this. So I'm going to apply a bit of pressure and peel down. You see how it's stuck. There's a little flake left there, but you see that golden flake right on the, it's on the spherical part of the hammer bone. We call that the short process or lateral process. Don't really want to touch that because it will touch the bone with the sucker, and it's only a small piece. We got some hiding in the ditch, and this is the inferior recess. So as we approach the eardrum, not only do we have a widening on the right hand side, in the case of the right ear, the left ear you'll have the widening on the left hand side. That's called the anterior recess, but we also have this little ditch, little trench just before the eardrum. And quite often you can get wax skin falling down that little well, if you like. So I'm just angling the wax skin slightly down. So you've got two pieces there. Again, this is right on the eardrum. I just want the suction to pull it away, which it did. And then there's one final piece. It's not actually on the eardrum, it's just on the top part of that inferior recess. So that's on the cliff edge, if you like. So that it's about to fall into the inferior recess. I'm just getting that in focus. Brilliant. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.